Hello, good afternoon, or good morning. My name is Stephanie Flores, and today I'm going to be presenting Managing Juvenile Diabetes with comparing an analysis of South Africa and the US. Country overview of South Africa. Approximately the population is about 60 million. South Africa is a middle income country with both advanced and limited healthcare settings. There is two types of healthcare systems, one being public healthcare, which serves the majority, and then private healthcare, which is for the population that can afford it. Youth diabetes is affected by socioeconomic disparities. What is juvenile diabetes? As the American Diabetes Association defines it as an autoimmune condition where the pancreas produces little or no insulin. It's also known as type 1 diabetes or insulin dependent diabetes. Most symptoms in children can include increased thirst, frequent urination, tiredness, and weight loss. Managing type 1 diabetes requires a lifelong insulin therapy, blood sugar monitoring, and a strict diet with diabetes education. Statistics and epidemiology. In South Africa, the access to pediatric endocrinology and diabetes technology is very limited. Challenges like this include monitoring and reporting the disease. In the United States, most systems are pretty advanced for screening and managing diabetes. In the US, there are approximately 304,000 children and adolescents that are under the age of 20 that are diagnosed with type 1 diabetes as of 2023. Causes and risk factors. In South Africa, there is a higher risk due to the lack of early diagnosis. Health literacy, which causes low awareness about type 1 diabetes, can lead to a late detection. Also, stigmas and myths about insulin can prevent proper care. And a family history of diabetes increases the risk of diabetes. So, genetic factors, if you inherit the gene, can increase your risk. Lastly, environmental triggers like diet. Not having a healthy diet increases the risk of diabetes. Prevention, care, and wellness promotion. In South Africa, the community outreach programs are mainly led by NGOs, a non governmental organization. Um, this is an independent group that usually addresses social, health, and environmental issues. It's less supported and are not part of the government and are usually nonprofit, which are funded by either donations, grants, or international aid. In the United States, there are many wellness promotions that include school based education programs, early screening with primary cares or referrals to endocrinologists, and there's multiple access to continuous glucose monitors and insulin pumps. Healthcare access and equity. In South Africa, most children depend on public hospitals. Urban rural disparities are lack of tools, staff, or doctors, which can cause long wait times in clinics. This leads to underdiagnosed and underreported diabetes. The access to insulin and managing tools remains limited despite insulin being on the essential medication list. In the United States, there is a higher availability of pediatric endocrinologists along with primary care physicians, and the access to diabetes technology is very advanced which is mostly covered by insurance. Programs and policies. In South Africa, there's a very limited national policies for juvenile diabetes. There is the National Department of Health, which offers chronic disease guidelines, but these implementations are inconsistent. It's mainly supported by non governmental organizations like the Mobile Health that brings diabetes education to rural areas or underserved areas. In the US, there is the Schools Diabetes Care Act, which was passed in some states just to protect and support students with diabetes in some charter schools or public schools. It just varies by state. Um, Also, guidelines are provided by the American Diabetes Association for diabetes. Um, so basically, schools must develop and follow a diabetes medical management plan for each student with diabetes. And the plan usually just outlines their insulin dose, blood sugar targets, testing times, and emergency protocols that need to be done while they are in school. Treatment and management. In South Africa, public sectors provide free insulin, but the supply is either inconsistent or limited. Blood glucose monitoring supplies is too expensive for most individuals. In the US, many treatment options like insulin pens that are automatically adjusted to a dose, also insulin pumps, and continuous glucose monitors, which is just a monitor with a phone that continuously monitors your glucose level throughout the day. Most of these options are covered by insurance or socioeconomic status. Here's a little table from the American Diabetes Association and the World Health Organization. Um, so we're just comparing the factors with between South Africa and in the USA. So access to endocrinologists is limited, as stated before, and then in the US, it's very broad. Technology availability in South Africa is low. As far as USA, there's many treatment options. Um, Free insulin in South Africa, yes, there is free insulin, but it just depends by public sector or limited supply. And then in the US, there's multiple ways to free insulin. Um, Continuous glucose monitor in South Africa is rare. In the US, it's very common. Most individuals, you'll see kids with a little circle on their thigh or their arm. It's mostly covered in the United States by insurance. Policies in South Africa are very weak, as stated before, and then in the US, they're very strong. So these are just some recommendations by the World Health Organization um, to improve disease monitoring system in South Africa, improve healthcare in rural areas, and increase education training programs for diabetes educators, and implement diabetes management programs in schools. Thank you. I hope you guys enjoyed my presentation on managing juvenile diabetes, comparing the South Africa and the United States. Here at the end is my reference page. I hope you all have a great rest of your semester.